Today, this little session, we're going to talk about infection prevention. And my department, the infection practitioners, to prevent infection in patients, cannot work without you and your department. It is a very important department in this institution. Cleaning the facility means we decrease infection risk, right? So that's what I put up here. That's my formula. EVS plus infection prevention equals a decrease in infection risk. So today we're going to talk about things that you need to know. We have a chance to ask some questions, but we will cover the important infection prevention for you and for our patients. Okay, patients, if the patients weren't here, we wouldn't have a job, right? We're here to take care of them. So when they come into our facility, patients deserve clean rooms, clean equipment, and to be touched with clean hands. All right? And you're a big part of that. Clean rooms, clean equipment. Okay, the cornerstone of infection prevention is hand hygiene. Washing your hands with soap and water when it's appropriate, and using alcohol, foam when it's appropriate. When do you wash your hands? Repeat that.
Every time I get out of a room. I mean, most of the time with infection.
You're most of the time in isolation rooms?
Yeah. Well, I use the foam and then I try to look for a sink where I can wash my hands.
Okay. So, after you take off your gloves, is that what you're telling me when you come out of a patient's room? Okay, can you see the scenario? You're in a patient's room, you have your gown and gloves on. She said she washes her hands when she removes her gloves. Is that what everybody does? Okay. When do you wash your hands?
The time when I'm doing something cleaning.
Okay. Do you wash with soap and water, or do you use the alcohol?
No, soap and water.
Now tell me about how. How do you do it? For how long?
For 15 seconds.
You're absolutely right. That's a great answer. When else should we wash our hands? What did your mother teach you when you were 2 years old? Wash your hands after you use the bathroom, after you play with the dog, before you eat. Okay. How about you? You have another avenue about hand cleansing. When do you clean your hands here at work? You work in the linen room? Okay. So, when do you wash your hands? After you take off your gloves, right? Because if you're in a dirty area, I would expect that you're wearing gloves and gowns if need be. Okay. Hands are important because people touch everything in this building. Elevator buttons, door handles, chairs. You don't know where that patient has been. So frequent hand washing is very important. But for these specific things, after you remove your gloves when you're cleaning a room, that's very important. Okay. What does PPE mean to you?
Personal protection.
You are absolutely right, both of you. Do you guys agree with them? And personal protective equipment are those things that this hospital supplies for you to wear if you are going to be exposed to blood and body fluids or to chemicals. Okay, and under PPE we have standard precautions. This is a policy and a law that will treat all patients as potentially infectious. This came out of the AIDS epidemic a long time ago, where we didn't know what we were dealing with, and we decided that we'd have to protect our employees from blood and body fluids. So that means gowns, gloves are available. And if you need masks to protect you from splashes, then so be it. You will wear a mask. Okay, so that's standard precautions. This equipment is available for you. Besides standard precautions in the infection controlled world, hi, welcome. We need other precautions if a patient has an organism or disease that needs to be contained. So we have our 4 isolation signs. Have you seen this sign? Okay. If this, yes, we see it a lot because it's for MRSA. It's for a resistant organism that some patients come in with. So we put up the sign so people will follow the directions and keep that organism in the patient's room. We don't want it spread out, okay? So what would you wear when you see a sign for contact precautions? Gown and gloves. Gown and gloves. A mask is not a wrong answer if you're going to be splashed, but because it's a contact precautions, gown and gloves will protect you and then protect other folks. All right? This is for...
It's not in the air.
It is not in the air. It is not in the air, so remember that. It's passed by contact. Well, now here's a special sign that we developed last year. For a special kind of organism, it's transmitted by contact. And it's called Clostridium difficile, and it causes diarrhea in some of our very sick patients. So if you see a brown sign on the door, what do you do? What do you wear?
Gown and gloves.
That's fine.
Clean with cloth.
And you clean with bleach. That was going to be my next question. How do you handle this room differently than a green sign? You clean with bleach. So you clean the room as usual and then use the bleach wipes to go all over the high touch areas to kill the spore of this organism. The other thing that's different is we require you to wash with soap and water because the alcohol won't kill the spore. Brown sign, bleach, wash with soap and water. Okay. So this is the chloride, this is what you use. What's the dry time for bleach? When you use this on equipment, it's wet, and do you wipe it off?
No, it's air dry.
You leave it air dry for 5 minutes, okay? Do you use the Santa Claus for anything?
On that room?
Not in the C. diff room, but for other rooms? But if you're ever asked the question, the Santa Claus, the dry time is 3 minutes. And the new containers will have a big 3 on it. So, the Santa Claus are 3 minutes, and the bleach wipes, which you use, is 5 minutes. If the cloth is kind of dry and it's not going to last for 5 minutes, then you can use another cloth to make sure that it stays wet for 5 minutes. Okay, that's 2 of the precaution signs. Beyond standard precaution. Hi, welcome. Okay, the last 2 have to do with some special things as well. Droplet and Airborne. How would you clean a droplet room? You can wear what you need for splashes, but what's required is for you to wear a surgical mask. No, not for droplet. Not for droplet. It's blue mask or this for droplet. Okay? For Airborne is an Air 95 mask. So you're required for droplet to wear this to protect you, and I'm going to demonstrate. And for Airborne, it's the N95 to protect you from that patient's possible tuberculosis or chickenpox. Okay? Gown and gloves will not protect you from that organism, but it will protect you for other things if you need to use it. Okay. Let me show you. This will demonstrate airborne particles. What are those particles doing? They're just floating around. Pretty soon they're going to smell the baby powder over there to show you if a patient is in airborne, you're not going to see those organisms, but they can float in the air. They're so little. Okay.
That's what droplets do, right?
Nope, I'm going to show you what droplets do. Okay? Droplets. This sign you're going to see more of because it's for patients with influenza, and it rule out meningitis, mumps and rubella not so frequently, but for influenza, and I'll show you why. I'm a cough.
Is that something?
Influenza, it's the flu.
Yeah. Oh.
Okay?
Going down.
So what's the difference?
It drops out.
This is heavy, they're large particles, they do not go in the air. So what do you need to protect yourself when you go into that room? You want to protect your mouth and your eyes, okay? So that's the difference. And you go in, you clean the room as usual. There's no special cleaning beyond what you use, the Virex.
So you don't have to wash the walls down and all that kind of stuff? Because it becomes contact. When it drops, it lands on everything.
Well, then you just clean everything like you would normally do.
That's what I mean.
Yeah.
You have to wash down the walls.
Whether it's Virex or whether it's the Santa Claus, it will kill the influenza. Okay, any questions on isolation? Have you all been fit tested?
Yeah.
Everybody can wear this mask. If you have a white and red sign, you know to put this on. And say there was an infected person and they just left. How long do you have to wear the mask when you're cleaning the room?
I believe until the room's clean.
Yeah, so an hour. If you know the patient leaves, the sign is on the door, you continue to wear the mask to protect yourself because he's right, the organism still might be there. Okay, I have sent memos out to nursing to leave the signs on the door until you people have cleaned.
That's what they don't do.
That's why I remind them all the time, okay? So when you finish with the room, you take this off and you take it to the nurse's station and tell them the room is clean. They need to do that. Mainly for this reason, and mainly for C. diff rooms, because you've got to know that that room needs to be cleaned. Bleach.
I have a question.
Yes.
There, the patient leaves, they charge some nurses so that the assistant nurses take care of all the sign in the door.
I know.
Then they just leave and they say check out, but they never tell us, what is that.
I'm trying to get them to change. Yes.
We are exposed,
Yeah.
and we don't know exactly how to clean that room. If
Yeah.
it's regular room to clean or is a special turning of clean. So there needs to know.
Yes.
Let us know.
Especially that side, because there's the special cleaning process, and you have to wash your hands with soap and water. And we rarely send a patient home that's infected. You know, they usually come out of isolation when they're no longer infectious. And you normally would clean the room the same way. However, you're absolutely right, and it's in our policy. It's in our policy in the infection control manual that the nurse leave it on the door. They just constantly need to be reminded because they want to get things going. Okay? But you are absolutely correct.
You already sent emails.
Oh, I've sent emails, and it's in the policy. Okay?
What about these rooms that expect within 3 minutes, and the rooms get halfway clean?
Then you have your policy and practice to follow. And you tell the nurse, I need to do these things. This is my job. If you have a problem, call my supervisor. Get it out of yours because you're following what you were told to do. You know, somebody come along, hurry, 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 that's going to diminish what you need to do to clean the room properly.
Like she was saying, sometimes we know because of the trash.
I know.
We look at the trash and we look at the gowns. So we're like,
And I
oh.
say, and I noticed because of the trash I saw gone. And I say, maybe something in this room. But when I asked to the nurse, say, oh yes, upon the precautions. So, but they don't let me.
Oh, see, that's very observant to see what's in the garbage. But they need to leave the sign up because there's no way that you're going to read their minds except by looking in the garbage. Okay.
And you know, sometimes it'd be like the patient might be there for 3 days and then you didn't cleanse the room for like 3 days and then the 4th day the sign goes up.
You know, this is unfortunate, but that's the nature of the beast in hospitals. Patient can come in for one problem and he gets worked up for that problem, and then they do a culture and it has something. Let me tell you, if this was a communicable disease, we would follow up with you, okay? We don't feel that you would acquire MRSA from cleaning the patient's room. But if this patient had tuberculosis and then we put him in isolation, you would definitely be on the list. Okay? That's another job of our department, is to keep track of infected patients. And EVS is part of the surveillance. Are you being called to work?
Yeah, for my supervisor.
Doesn't she know you're in here?
No, but I don't know why.
Oh, well, I'm almost done, and you can give a call.
I don't know. What's the difference with the brown and the green? I know the green is for people that you don't have to come as long as you stay 15 feet away.
No, that's the blue sign.
Oh.
The blue sign is droplets. What's the green sign? It's a disease transmitted by touch, so you would want to wear gowns and gloves. And then what's important about the brown sign? This is a good question.
I rarely see it.
You rarely, where do you work?
Right, children's.
Oh, at Children's, the children's floor?
I never see that sign.
You probably won't.
I did
It's
see
more
it
of
one
an
day.
adult.
I saw it last week.
But what's important about the brown sign?
I see your hands, the soap in the water, and the Clorox.
And the Clorox. And what do you wear on your person? PPE. Happy PPE. Yes. Okay, you guys are great. The other thing that's come up, and people have talked about it, is your own health alert. If you're coughing and sneezing, don't come to work and spread your organisms. You need to stay home if you're ill, or practice covering your cough if it happens. Another.
The nurses, they do the same thing. They still come to work.
Why is that? We in healthcare don't tend to take care of ourselves.
Exactly.
I would send them home if I saw somebody that was sick and had symptoms of the flu. Okay. Do you have any infection control questions that are burning to get answered? What has come up recently are bed bugs. Bed bugs. Bed bugs, hotels are being inundated with bed bugs, and occasionally we would too. Just know that this is not a person-to-person spread like lice or scabies. If you find some little critter while you're changing a bed or you're cleaning a room, call your supervisor. They need to have the exterminator come and identify this. There's really no special handling. You clean the room as usual after it's been exterminated, and just bag the linen, okay? But if you see anything unusual like bugs, it's not really, I mean, we get bugs calls all the time, but let your supervisor know so an exterminator can be called. Great, you guys are super.